me.
Please welcome. Have a seat, sir.
Yes, thank you, thank you.
Thank you very much, sir. Good morning. Introduce me to pharmacy Adi Saputro from Apotek Uti, which is located in country number 90 Semarang City, Semarang City District. I apologize in advance. Thank you for waiting for the receipt that we have prepared. With other, I already talked to Miss Sila, 40 years old, weight 70 kilograms, height 160 centimeter.
No, I'm first son. That's my mother. My mother waiting outside.
Okay, thank you, sir. Thank you very much, sir. Identification, sorry, Mr. Siola, the mother, patient, alone or with relative.
Yes, she is with me. She is
With me. Yes, your name?
Gerald.
Gerald. Thank you very much, Sir Gerald. Sorry, Mr. Siola. Sorry, the mother, Mr. Gerald. Permission. Ask the patient, mother, Mr. Siola. It's time to explain the useful of prescription counseling for the medication that you will receive, Sir Gerald.
Yes, I have time.
Thank you very much, Sir Gerald. Sorry, Sir Gerald, asking the patient whether the doctor has explained about the medicine given.
No, not yet.
No, thank you, Mr. Gerald. Not yet. The information is correct according to the doctor. Only provide an explanation of the hope of the drugs, where the drug will cause the complaint that are fit will gradually disappear. Sorry, Mr. Gerald. During the I will explanation to the Madam Cecilia the name of the medication, indication, how to use it. One therapy, sir. One therapy is arsutoxyclic acid. Indication gallstone. Dose twice one tablet. 250 milligrams. Take with meals. Take in the morning at 7 and at 7 in the evening. It is explained to humbly with the drinking rules that I recommend, so as to increase adherence and support the effect of therapy and relative pain. Adverse effect: headache, back pain, diarrhea, dyspepsia. Regarding side effects, sir, don't worry. If you deal with the rules, I suggest that this side effect can be minimized, which is also supported by different people's immune system. After that, is to recommended to Mr. Siola to determine whether the symptoms that appear are caused by inflammation and bile infection or not. The doctor will perform a physical examination, blood test, and scan test using ultrasound and CT scan. Doctor will perform surgery removal of the gallbladder or cholesterolostomy. This operation is also usually performed to prevent the spread of bile infection. Surgery removal of the gallbladder can be done through general surgery or laparoscopic surgery. If the bile infection is caused by gallstone, treatment may include an endoscopy procedure to first remove the stone in the bile ducts. After that, a new colostomy procedure is performed. You might experience several complaints such as fever, pain, and flatulence after the operation. To overcome this complaint, the doctor will provide antibiotic and painkiller. Can you ditch the drug usage, sir?
Yes, sir.
Thank you very much, sir. To therapy, sir. Cefixime indication to antibiotic. Dose 1 tablet 250 milligrams. Take with meals. Take in the morning at 7 in the evening. It is explained to humbly with the drinking rules that I recommend, so as to increase adherence and support the effect of therapy and relative pain. to 1 tablet, 200 milligram consumed as a meal of before meals. Use a glass of the swallow to cefixime capsule and tablet whole. Do not split cross of Q the capsule or tablet. Caution: do not actually if the complaint is rather better to stop using antibiotic because it can cause resistance and make the bacteria immune so that the mother Miscela is given a large dose and will have an impact on pharmacology effect of the mother, please. After effect diarrhea, regarding side effect, don't worry, sir, Mr. Galat. If you didn't meet the rules, I suggest that this side effect can be minimized, which is also supported by different people's immune system. Monitoring inflammation of the bile, or also called cholestasis, occur due to obstruction of the flow of bile from the bladder to the intestines. This can occur due to various conditions, one of which is bacteria infection. Therefore, is after the explanation in infection Miscela is found as the cause of bile inflammation. The treatment given is of course antibiotic. One of the antibiotic that can be used as a therapeutic option is the third of 4 generation cephalosporin. Cefixime is the 3rd generation cephalosporin called antibiotic. Can you dig the drug, sir?
Yes, I can accept.
Thank you very much, sir. 3 therapy, sir. Ketorolac, indication 20 milligram once dose to 1 tablet. Where is the moderate pain level? Miscela, if need, ketorolac can be given every 2 hours. The maximum dose is 90 mg per day in patient weighing Miscela 50 kg. The maximum dose is the 90 mg per day. After the effect headache, this drug should not be ignored for its side effect. Where to overcome the level of moderate pain, the mother become mild pain and relief complaints, sir. Can you mix of the drug, sir?
Yes, I can accept.
Thank you, Mr. Gelat. For the therapy is the atorvastatin is the continue bi-release cholesterol. Mr. Silang, the rules for using atorvastatin 5 mg per 24 hours every night before sleep are side effect of back pain or joint pain and hypolipidemia. I have quit a medication. Can you this of the drug, sir, for therapy?
Okay, I accept it.
Thank you, Sir Gilat. I have quit medication schedule that is tailored on the patient daily activity and asks if the patient has difficulty following the schedule, sir. Sir Gilat?
No, my mother will take it.
Okay, thank you very much, Sir Gilat. Describe the necessary action if you forget to take your medicine. Sir Gilat, given disciplinary education and do not forget to ask or consume drug. If the next drug use is imminent, skip the previous drug and don't double the dose. Okay, Sir Gilat?
Yes, okay.
Okay, Sir Gilat, untuk istilah sorry letter explain this the need to be avoid while taking medicine. My pharmacist Adi recommended being give education on the handling of the drug side effect with non-pharmacology treatment. Patients are encouraged to do sport activities, mainly ideally weight, maintain their diet, especially the nutrition needs of the protein, some amino acid, and to drink lot of water. Whether waiting in temporarily do not consume drink that contain big alcohol content, sir. Okay, some foods that should be limited or even avoid for people with gallstone and cholesterol, along with pine. Avoid sweet, salty food, along with nuts, fried food, offal. Do not consume drink that contain high alcohol content. Describe possible drug or the drug food interaction and ways overcome it. We're if there is a drug interaction and complaint that are felt, you can contact the doctor. Okay, explain the correct way of storing, Sergela. Yes, patient are give education on how to store drugs. Namely, drugs are not stored at room temperature and are not exposed to direct sunlight. Please excuse me, sir. Repeat after me to the first treatment to Mr. Sila, Sir Gela.
Yes. I can. But
Thank you, Sir Gela.
would you mind to remind me what his name is?
Would you remind me as eustrovolic acid, Sir Gela?
Folic acid, yes. This
Yeah,
is twice a day.
porsidiosolic acid, ya tadi.
Yes, twice a day.
Tuesday,
In the morning and in the evening.
in the morning and evening, 7 a.m. and
7 in morning.
7 in the morning and 7 in the evening. Yes, sir.
This is ceftriaxone.
No, sir.
I
No.
was mistaken.
It's the cefixime.
Oh, cefixime.
Cefixime. In the indication in antibiotic,
For the usage, I forget the usage. The
the
dose.
dose twice a day,
Oh, yes, twice a day.
twice a day,
After meal.
after consume as a milk or before milk.
Oh, yes, okay. This is ketoprad.
Ketorolac, sir.
Oh,
Ketorolac indication
ketorolac. Oh,
twice a day.
okay.
Where is the moderate pain fine? Moderate pain fine level is what?
For the pain, yeah, okay.
Can be give every 2 hours.
Yes, every 2 hours after pain.
Yes, sir. But
So the last one is.
other first statin, sir?
Oh yeah, the first one. This is for cholesterol, right?
Yes, correct, sir. Correct,
Once a
sir.
day in the night. Once a day in the night.
Once
before
a
sleep.
day before sleep.
Okay, I understand. Thanks.
Thank you, Mr. Gelat. Alhamdulillah. I hope you get your son, Mr. Sila, Sir Gelat. Thank you very much.
Thank you very much. I will come again if I have any problem again.
Please, Mr. Gelat.
Thank you.
Yay.
Rekam.